Nina, hi, welcome. It doesn't matter if your cameras aren't working. We've used Teams webinar to do this event. So delegates are on mute and their cameras are off automatically. And there will be a question and answer opportunity. So if people do want to put their cameras on at the end, that's absolutely fine. But somebody just said that they didn't have a working camera. That doesn't matter. As long as you're able to contribute, there'll be lots of ways for you to contribute to the webinar. So we're a couple of minutes in, so I am going to start, although I can hear people pinging in the background as they're coming into the virtual lobby. I'd like to say a big warm welcome to everybody. We have had a huge amount of interest in today's webinar, which will be looking at the DASH risk assessment and the Dara risk assessment. And we will be looking at the context and history, how they've evolved, and the difference and how they can work well together. We are also going to be recording all of the webinar and putting that on our website, and also the police will be also taking that recording away for their audiences. And any questions that we don't get to today, if we haven't got time, we will also be providing written answers, and they will be accompanying the recording of the webinar. So if you miss bits or colleagues couldn't be here, that will all be materials that everyone can access, and we would really like you to do that with your staff, team, shifts, whoever, for training purposes. So I think the majority of us are in. A big warm welcome to delegates. A big thank you to Clara, who's our interpreter today, who's going to be signing. And also we've got Kerry-Ann, who will also be swapping with Clara because it's exhausting work. So they're going to be a bit of a tag team there. So thank you, both of you. And a big warm welcome and thank you to Louisa Rolfe, who's joined us today. And we are going to try and do a bit of a conversation for the webinar. So I'm going to hand over to Louisa, who's going to introduce herself and tell you a bit about her, and then it'll come back to me, and hopefully we can enjoy a real good conversation and take lots of questions and queries from the huge amount of people that are entering the webinar. Don't look, Louisa, it's just me and you. Over to you.
Hi, Jo. Thank you so much, everyone, for allowing me to join you today. My name's Louisa Rolfe. My day job is as an Assistant Commissioner in the Met Police, but I've been the National Police Chiefs Council Lead for Domestic Abuse since 2013, and in that time worked in Avon and Somerset, West Midlands and the Met. And I'm really delighted to talk to you here today about the work that we've been doing in policing and with partners and key stakeholders like the brilliant charities who support victims of domestic abuse and the many IDVAs around the way that we understand risk victims face.
Thank you, Louisa. So I'm Jo Silver, I'm the director at Safe Lives. Safe Lives is a second tier, third sector charity, which in a nutshell means we don't provide service provision on the front line like lots of our colleagues do, a brilliant work in that. We work mostly to develop professionals around training. We work heavily looking at data and information, and we look at different practice. And most importantly, we're working very closely with voices of those who've experienced domestic abuse, whether that be as children, victims and perpetrators of domestic abuse. And we use all that information to influence the influencers and always strive to improve the responses to families experiencing domestic abuse. So that kind of sits us squarely in the conversation of risk assessment. And before we go into the content of that, there's a few things that some people might find helpful. So we've got a hashtag today, which is hashtag domestic abuse, or there's another hashtag called hashtag dash. We've also got a couple of ways that you can come and seek support or guidance or clarification. So we've got an info@safelives.co.uk email. So do get in touch with us after the webinar if you need to, or if you want to even. And what we're going to do is we're going to spend 45 minutes really, as I started to say, starting at the beginning, why a risk-led approach to domestic abuse, because that's still not clear for everybody. And then we're going to talk about the difference and the evolution of risk assessment in the UK and where we are now. And then we're going to talk about a little bit about what next. So what does all that mean if you're a practitioner? And what does that mean for the future of a DASH assessment? Or what does that mean for whole family assessment? So that's how we're hoping we're going to cover off today's webinar. So I'm hoping that you're in the right webinar and that's what you were expecting. It's a bite-sized opportunity. It's by no way a comprehensive training session on how to risk assess victims of domestic abuse, perpetrators, children and young people. There are lots of routes for you to access training through lots of different ways. So if you want to get in touch with us about proper domestic abuse risk training, then please do. And Louise will be covering that off for the police. So what is risk assessment? And firstly, why? So in this country, really, 20 years ago, there were pockets of good practice around looking at domestic abuse through a risk lens. But there was no way a consistent national approach to understanding domestic abuse. And what that really means is it's potluck. So it's potluck if you're a victim, that you are brave enough and the opportunity arises that you tell somebody that you need help. The potluck bit was who you told knew what to do with it. So this was 20 years ago. And what that really translated into was police were probably looking for injuries and a physical assault, which is something the police would be able to grip and do something with, and they would have laws, legislation in place to help them do that. Health visitors would probably think about how that might impact your parenting ability and try and understand from a medical point of view what that meant. And probably housing officers probably just thought, well, perhaps I can try and put them to a top of a list somewhere. There wasn't any consistent national guidance around what domestic abuse was, how it was experienced, and what levels of risk meant when you were thinking about domestic abuse. And there are loads of people who are in very unhappy, unhealthy relationships. So we do have to have a way of understanding what domestic abuse means when we think about the resources that are needed and the resilience that families themselves and victims themselves have. So it wouldn't be appropriate for us to say everybody that tells anybody about domestic abuse needs to have a police intervention, IGFA, and they need a coordinated multi-agency response. That's not an appropriate use of our resources and is quite insulting to some people who may well just need a helpline or a website. They may be able to understand that the relationship they're in isn't a healthy relationship. They have the tools and resources and are able to seek help through websites and helplines. And that is a perfect solution for lots and lots of people right now, and still is. So we are not suggesting that all domestic abuse needs all of everything. What we are saying with a risk-led approach to domestic abuse is, in those opportunities as professionals, when victims are brave enough to tell us what's going on, we have the best tools in our hand that help us make the best decisions for that victim at that time. Now, it's not going to be perfect, but what we've done over the last 20 years in this country is to say, We understand risk and domestic abuse. We as a system responding to families have a shared understanding of risk, and we have a shared understanding of how we should be supporting people experiencing domestic abuse. And that looks slightly different in different areas due to local communities and local services. But simply, we do have a risk-led approach to domestic abuse. And I will just bang on a little bit more about that, because I think it really is important, because I think we've taken that for granted. And unless we all continue to understand why a risk-led approach to domestic abuse helps us meet the needs of families where they are with our limited resources, we will go back to victims that shout the loudest, victims who've got the worst physical injuries, and we will not be aware of uncooperative or frightened victims, and we will certainly not get any better identifying risk in communities that don't naturally trust authority. So it is really important that we understand why a set of questions in the right hands of somebody that's been trained in risk assessment can really help change victims' life on that first opportunity when they've asked for support. So that's what a risk-led approach is. And what it helps us do over time is we have started with the Metropolitan Police about 20 years ago. They used a risk assessment when dealing with domestic abuse incidents called SPECS, and then it was SPECS Plus, then it was SPECS plus something else. And in Cardiff, where I was policing, we had a family support unit form, which was called an FSU 9, not very glamorous, but we were all trying to do, and we had Merit, I think, in Liverpool. We were all trying to do something to understand how this big need was met with our resources in the most responsible way that was empowering the families themselves as well, and not overpowering them. So all of that was bubbling around, and there was some brilliant work being done in the States and in other parts of the world. And that kind of all came together with a few key people who will be mentioned throughout today. And we ended up with a lot of analysis to understand, right, we've got this domestic abuse, stalking and harassment, which is now shorthand as the DASH, that all agencies will be able to use on the front line, whether you are a specialist independent domestic violence advisor, whether you're a police officer or whether you're a housing officer, second day on the job, all good intentions, but don't really know much about domestic abuse. This DASH tool will help you provide better service to people who are telling you they're experiencing domestic abuse. And there was a slight difference between the actual form that police used and the actual form that I will call non-police agencies used. And that was a couple more questions around children, and really to alert police of safeguarding duties and issues at the scene, because as you know, the police are normally the first people to deal with the imminent risk. So we've trundled along with DASH for a long time, and it helps us at a community level. It helps us understand identification. So as I said, using the tool, if you've had the training, it will help you make a decision whether the person in front of you needs to have some advice about signposting to a website. You need to signpost it to a colleague within your own organisation who has more skills around domestic abuse, or it's quite clearly a high risk case and there is a care pathway in your local area. So that identification piece of work that I talk about is just hearing what victims are telling you and having the right questions at your fingertips to ask. And when I say that, we ask about pregnancy, we ask about previous convictions. Now, if you were a health worker, you might ask about pregnancy. but you really wouldn't ask about previous convictions. And if you were a police officer, you would definitely be thinking about previous convictions, but not necessarily might you be thinking about if you separated from your partner in the last 6 months, or if you had a child within the last 12 months. So it's a real way of helping professionals build on their professional judgment and think wider than just the remit that they sit in when it comes to risk. So really important, and we've evolved that. And in
Sorry
the UK,
to interrupt. Could we switch interpreters, please? Sorry. Can we switch?
Yes, of course we can.
Thank you.
Carry on. You're on the screen, so yeah, that'd be great. You're fine to go. So we have evolved that, and we've taken feedback, and what that's enabled us to do is to confidently say that most victims of domestic abuse who are accessing statutory services and voluntary specialist services are being met with a consistent understanding of what professionals are looking for and what the care pathway is in their area if they are high risk domestic abuse. And that pathway should include independent domestic violence advisor, somebody to walk alongside them and help them negotiate and navigate the local landscape and the challenges that that holds, and also be centre of a multi-agency risk assessment conference where all of your local resources sit around a table and focus on one case and to understand what it is that they may be able to do in a coordinated way that are challenging perpetrators' behaviour, holding the perpetrator accountable, supporting the victim to go through a criminal justice system or to provide a safety plan for them that's unique to their situation, and ensuring that our systems are aware that the children and the young people involved in that. So when I talk about a high risk care pathway that's embedded in a local community, that's what we're talking about. But this system's not just around high risk. This system also enables us to understand families who are experiencing standard medium risk. So still not in a great relationship and certainly not in a healthy environment for individuals to thrive and feel that they're trusted and supported at home. But there are different care pathways in local communities around early help hubs. There will be different services that can provide support for victims who want support and who are locally accessing different statutory and voluntary services, even if that's something as simple as a community centre that gets together and talks about loneliness. I mean, victims of domestic abuse don't always want to be that title walking in to a situation. And if you're standard risk domestic abuse victim and you choose that the community is the way you'll get your support, then that's exactly your choice, and we would support that. So I hope I've just reminded all of us why risk assessment and a risk-led approach to domestic abuse is important. It also helps avoid stereotypes and assumptions where perhaps we might think that big, strong men aren't victims of domestic abuse, or where we might think rich, independent, intelligent women aren't victims of domestic abuse. So it flattens out all those assumptions and stereotypes that we've built up over our professional and personal lives. The other thing that's really important to say in this webinar is that we're not going to be covering any in-depth case studies. We also know that, you know, there's no M&S. Domestic abuse is there for professionals as much as anyone else. We are people. So there are no health warnings around any case studies that you need to think about. And I would appreciate if, when we're asking questions, if there is detail in there that might be triggering or upsetting, that you come to us with those questions via another route. Okay, so I think I've opened up the conversation as to why. I'm just going to talk about the dash. So the dash, as you know, we've got all the materials in the chat. So in there, you've got real in-depth guidance on how to use a dash. That's specifically for IDVAs. You will have materials around how you go to Marek and Marek toolkits. So if you're a housing officer, there'll be a toolkit for housing officers that you'll be able to find on our website. So all of that care pathway, local community response I've just talked about, all the materials will be in the chat for you to go away and look at the finer detail and come back to us with any questions. So I'm just going to pause there and give Kerry-On a little chance to take a breath. And I'm going to hand over to Louisa, because Louisa's going to give us a bit of an overview of where the police are on that journey to date. Is that okay, Louisa?
It is. Thank you so much, Jo. Really lovely to be with you today and have the opportunity to talk about this. And I was keen to talk about where we are in policing with risk assessment. So the great tool that is Dash has been used by many forces for many years. And when I took on this role in 2013, lots of questions were raised by me about the Dash tool, and so I commissioned the College of Policing to look at how policing use the Dash tool. And what we found, and Professor Amanda Robinson from Cardiff University led that initial review, what we found is that there was inconsistent use of the tool by police officers, particularly our first responders, and that it was reliant on them having a good understanding of the dynamics of abuse. And we know that our first responders to incidents are often our least experienced officers. So we looked at, could we develop something that was less dependent on that training and less dependent on, and so because we want this to work every time, don't we? So working with the College of Policing and Professor Amanda Robinson, we looked at developing a tool that would be, more focused on our identifying higher risk domestic abuse, particularly coercive controlling behaviour, more user friendly for first responders who might have a limited understanding of the dynamics of abuse. We do train officers in responding to domestic abuse, and the DA Matters programme, I mentioned it in the chat. And I can see the question in the chat about West Yorkshire Police. I think they're rolling it out right now. I've seen something on Twitter this week, which is actually from Save Lives, to say they're mid rolling it out. That programme is proven to increase officers' empathy with victims and their understanding of the dynamics of abuse. But our first responders, 1 minute they'll be responding to a collision, the next they might be dealing with an offence of shoplifting, a burglary, youth violence, and then the next minute they're attending an incident of domestic abuse where victims may be facing horrific risk, but that might not be obvious to an officer that doesn't have a sophisticated understanding. So we wanted a tool that would support our officers in asking the right questions, to really be, a lot more open questions. And what we found with Dash is that officers were a bit like Jo's opening of 20 years ago. Officers were gravitating towards their signs of violence, looking for physical violence, or very focused on the current incident. They weren't asking enough about why victims might be fearful, what was the history of the relationship. So the Dara tool, actually, it has less questions in it. I think the other thing about Dash we found is over the years it's developed and evolved, and lots of good content in there about things like honour-based abuse and sexual violence, but officers weren't always understanding why those questions were relevant. So it became almost a perfunctory to-do list of I must ask, and I can't imagine anything worse for a victim than an officer with limited understanding asking them a series of intimate questions. Now we know that those Dash tools are used really well by our specialist investigators in policing. They're used really well by IDVAs. They're used really well.
Sorry, Louisa, to interrupt. Sorry, 1 minute. We've had feedback that people can't see the interpreter. So we're just going to pause a minute. And Clara, I wonder if you wouldn't mind turning off and turning on again, because we're worried that the people that need to see you can't. So sorry, Louisa, just a few seconds.
Can you see me now?
No problem.
We're finding out through my brilliant colleague Sarah behind the scenes.
Thank you for letting me know.
Some yeses in the chat, if that helps.
I think we're good to go. Sorry, Louisa, for the interruption.
What would you like to do about the missing information that's not been signed?
Clara, we're recording, so we don't know what part was missing yet, so it'll be fine. Thank you.
Thank you.
Go on,
Thank
Louisa.
You. Thanks, Clara. Thank you, Joe. So the Dara tool was developed with the support of Professor Amanda Robinson. It has less questions within it, but it has more prompts for officers to delve into what might be happening. So if an answer to something is yes, then they're expected to then delve into that issue and seek more information. It's more user-friendly, so tighter questions and less sort of lots of different concepts to explore. And also it removes some of the questions we knew that officers were finding it difficult to ask and victims difficult to respond to in those circumstances. Less reliance on free text, but lots of prompts that would lead to open questions, and therefore officers including free text where appropriate. And what we found in the initial assessment of that guidance is that it was identifying more high-risk domestic abuse, more coercive and controlling behaviour, and even those questions we'd removed about sexual violence and honour-based abuse, it was identifying more of those things. So actually, by removing the direct questions that might have felt confrontational for a victim, but really seeking to understand what's going on, officers were responding better and eliciting more information from victims. The Dara was only ever meant to be about those first responders with limited training and understanding, and it's designed to be seamless to the Dash. So we would expect our officers in specialist teams who conduct often, when a first responder attends an incident, that case is then referred to the domestic abuse investigation team. We would then expect the specialist team to conduct a Dash risk assessment and to evaluate what they've seen in the Dara form. We would also expect that referrals to other agencies, to IDVAs, to partners, that the Dara would provide a good basis for a further assessment. Now, if forces don't have specialist domestic abuse teams, the Dara will still work in terms of enabling you in that referral process to other organisations, but you can, forces have a choice to use the Dash assessment in those secondary investigations, whether it's a specialist team or not. But Dara was really about addressing that lack of understanding and that poor use of Dash by first responders. And I think this, the Dara is not about saying Dash isn't the right tool. It's about how we work with the workforce we have in policing to get the best risk assessment and ensure that victims get the best service we can offer them. I can see questions in the chat. And I can see some helpful interjections from forces as well. So I think we've got some links to the Dara tool that we can share for people. Also, the evaluation. So the Dara tool, as said by Kent, it was rolled out in a pilot form in a number of police forces. It was then subject to independent evaluation by academics and the College of Policing, who looked at how it was used and its effectiveness. It was then went to a further 3 forces, so 6 forces altogether, for further evaluation to address findings from that first pilot. Then through the College of Policing Professional Committee, where it was approved as the preferred tool for first responders. The college are now supporting forces in a national rollout. That will take us some time because we want to get it right.
Thank you, Louisa. So I can see the chat going crazy, so thank you for that. If you want to give us some emojis to make us not feel like we're on our own, so some thumbs up or hands up, because it is a bit soul destroying looking at yourself, knowing there's a load of people listening to you. So thank you, Louisa. I just wanted to so to be clear and to provide clarity. So we are talking to all professionals and explaining that Dara is the evolution of Dash, and looking specifically at the role of the frontline police officer, who is normally the first person in that crisis situation to gather the right information and be as well informed as can be in those really hard calls to deal with. And then we are talking about what's the role, who uses Dash. So right now, Dash, we've done a review on that as Safe Lives. So we've pulled together, it's critically important to Safe Lives not to take our eye off the ball with this. So we've pulled together a number of academics, experts. So I'm going to put a slide in the chat so that you can see some of the organisations that we were consulting with. So from tiny buy and for services around both domestic abuse, children and young people, services, voluntary services working with disability. We have talked to the big statutory organisations, so safeguarding children, safeguarding adults. We've thrown the net out as wide as we could in our review around Dash. And I just want to be clear that no one is giving any guidance to say that Dara should be used by multi-agency partners. That's not why it was reviewed. It's not why it was designed, and it's not based on that evidence. So we would be very clear here and say multi-agency partners, where domestic abuse is identified, should be working with a Dash. So Safe Lives are aware, like a lot of the work in domestic abuse, you know, we're really running at pace at domestic abuse now. That hasn't been the case for the whole of the 20 years, but we've got new legislation around non-fatal strangulation. We've got domestic abuse, the new act, you know, we are really running at pace. So what we are very clear at Safe Lives is Dash is fit for purpose. We have done an initial review, and stakeholders are still saying that Dash is a valued tool that identifies risks and helps us open up the right conversation with victims and survivors. They are also saying it could be improved. It could be more accessible to different groups of survivors and communities. There could be more around strangulation. Now we know more about the risks associated with strangulation. It talks about coercive control and embedding the DA legislation within the actual tool. I'm always aware that when we talk about a piece of paper as a tool, we expect it to grow arms and legs and walk our practitioners in the right direction. That's never going to be the case. We have to support our practitioners with their professional development and them being aware of their networks and their signposting, because whoever you are, you cannot deal with domestic abuse on your own. We all, you know, when it's high risk, we do need to come together in a coordinated way to do that. The other feedback that we had was the length of the Dash. So that came through again. So that's what Louisa found, and that's what we found. So people are saying this, it takes too long to do the Dash. And as an experienced person in this sector, in this field, I will tell you 20 years ago, there were 10 questions on the Family Support Unit 9, which was our original form in South Wales. And my job was to train South Wales police to use it. And their feedback was there was too many questions on there. So whether there's 10 or 24, I think there's more about police and practitioners just understanding why those questions are important, because if you know, you will care, and then you will ask. You know, I think that we have to remember, people given a form that they don't know why they're doing it or what it does. I am definitely the first person as a practitioner to put that form quickly away and never use it again. So I do need convincing, and I do need some support to do that right. The other feedback that we had was that they felt that there's some structural things that could be better. And of course, with technology now, and as the Dara does, there should be ways that you can click through things. So if you identify a risk, that leads you on to other questions to explore further than that. So that was some of the feedback. And the feedback from victims and survivors themselves was about the language. And this is exactly right, because although we created and tested the Dash a long time ago with survivor groups, we weren't all thinking about trauma-informed working then at all. And really, we that conversation. And now the feedback quite clearly is the questions need to be framed in a trauma-informed way, so that people can access the questions when they are experiencing trauma. So I just wanted to tell you that as part of our review, we are continuing to work with the Home Office. We're hoping to work with the Ministry of Justice. We're working with Louisa and other leaders in the field, really, to see when the right time would be to evolve the Dash to the next stages. But I just wanted to be clear on this webinar that at the moment in the UK, Dash is fit for purpose, and we continue to use that. Where you have professional judgment and you can improve that in your own practice, then please do. It's never been a tool that should limit you. It's always been a tool that just should support you to get the basics right at the time. So that's the clear message from today's webinar. We've got loads of questions. So just to remind everyone, we will answer every single question. We probably won't have time to do it here. We will definitely do it in writing, and it will accompany the recording of this, because we want it to be like a package of information that you could cascade. There's been so many leaps forward in domestic abuse and understanding it, not only the legislation. We also have Jane Monckton-Smith, Professor Jane Monckton-Smith, and her domestic homicide timeline. And I know for one, victim support are using both Dash and the domestic homicide timeline to complement each other. So there are lots and lots of work that everyone is trying to improve. We just all need to work out how to do that effectively and efficiently for those who are actually doing the work on the front line. So a couple of questions, Louisa, I think have come in, but I am going to try and go around the other way. Okay. So a question for Louisa. Okay. Oh, somebody's called you mom. I want to start with that.
No.
So they're from Cumbria. Cumbria, so it's police. Could we discuss the pilot? Cumbria are beginning to look at rollout in the Dara and interested in how we continue to use the Dash with our secondary officers. I don't know if that's a question, really, just I suppose asking where that's being done, Louisa, and if they can contact any of the forces that are doing that.
So I can see that there are officers on here from Kent, but also West Mids and other colleagues. So really good to speak to other forces who have tried this. And I think really, you know, if you can speak to colleagues, but the college are really keen to help forces in their rollout. So I would say speak to colleagues who've done this, who I know it worked well, and that was a key part of our considerations, because Dash is such a trusted, a tried and tested tool with partners, but also with specialist teams if you have them, that it's important that the Dara was seen as an enhancement to that. And this is about, you know, I can see that people have concerns about, you know, what might be changed, what might be the deficit of first responders using Dara. But I just wanted to reassure people that this has been through rigorous academic evaluation by academics who are not connected to policing. You know, they're academics who are passionate about violence against women and girls and want us to improve that we, you know, the way that we respond to victims and the way that we identify risk in domestic abuse, and the Dara has been proven to do that. That's why we want to roll it out. So and the, you know, and what it does is it sort of, I can see there's been a bit in the chat, a bit of toing and froing about honour-based abuse, and I think there, I mean, to be clear, my understanding is that the Dash did not have a specific question of, are you a victim of honour-based abuse, because that term might not mean things to a victim, but it did include questions about multiple perpetrators and wider family relationships. The Dara has been shown in the evaluations to identify more honour-based abuse, and surely that's a good thing. I'm not claiming for 1 minute we haven't got an awful lot more work to do to work with marginalised women and minoritised women in terms of our response and recognising the barriers to reporting, but also the particular concerns they might have about coming forward. But this is about a tool that helps us to work with the workforce we have to drive better understanding and identification of risk, and the evaluation would suggest it's taking us that way in the right direction.
Thank you, Louisa. I just want to go, if I can, to Joe. Sorry, Joe, I've got so much going on my screen. Some my colleagues just said you've waited patiently with your hand up forever. So I hope you know you've got your hand up and you are waiting. But all eyes on you, Joe. Over to you. I think you want to ask a question. Oh, sorry, Joe. You didn't realise you had your hand up, did you? Okay. I do that all the time. So we're going to move on to one more question, I think. Sorry, we've got, can we clarify that the Dash is to be used by agencies, because there's comments in the chat. Okay, so the clear message from Safe Lives and the police is that Dara has been designed, evaluated for frontline policing to engage officers and get as much information as they possibly can to make the right decisions, the best possible decisions. And what we're saying is, for multi-agency partners who aren't frontline police, that the Dash is still fit for purpose. We do understand that it can be improved, but at the moment, I've just been on a non-fatal strangulation course with New Zealand and Australia and America, and looking at their risk assessments. So we are talking about evolution rather than chucking the Dash out and starting again. It could be improved around inclusivity, but all non-police organisations should be using the Dash in their business as usual, and should be using that Dash to do a referral to Marek where the risk level is appropriate. So we have 1 minute left. I know there are a load of questions. As I keep saying, they won't just disappear, your questions. We will aim to have those questions up by the Monday of the following week. My colleague is saying we'll have it up in a week, but I think looking at how many questions we've got, and some of them are very technical, we might need to get some technical responses. And we have got those academics who were involved on standby to answer those questions. So what is the date, Sarah? Week Monday. We will put the recording on our website and all of your questions will be answered. And any comments that you've left that we will be taking away to consider in the conversation about how to review the dash, when to review the dash, and what does that mean around resources and organisations being involved so that it could be improved. So it's the 29th of May. So if you can stick that in your diary now to check our website, because otherwise if we say we'll email it to you, that all might just sit in your inbox. So the 5th of the 29th of May, take a look on the website and hopefully you'll find really useful resources for you to cascade the information to your shifts, to your teams, to your managers, to your bosses, with some frequently asked questions. And in the meantime, do get in touch with us at all of the ways you know you can, and we'll be more than happy to follow up individual conversations. So just a big thank you, Clara, and carry on. Thank you, thank you, thank you. You look like you've worked harder than Louisa and I have all day. That looks exhausting, but well done and thank you very much. I'm sure our delegates really appreciate it. Thank you, delegates, for coming. There's obviously an outstanding level of interest in this conversation and we will continue it. And a big thank you, Louisa, for coming and be part of the webinar. It's been really good to have you here and we've really appreciated it.
Thanks for having me. Thanks, Jo.
And a big thank you to Sarah behind the scenes, who never gets to show her face, but is always there like a comfort blanket, making sure everything goes right. So a big thank you to you, Sarah, and I don't mind that you're blushing. So I hope you have a good rest of your day. Do get in touch with us. Do not hesitate to get in touch with us for some of the more technical questions. I think some of you want answered. We do want to answer them. Thank you very much. Bye.